Okay, so imagine this. You're rushing through your day, right? Juggling a million things, and suddenly you trip, you skin your knee.
Oh, no.
No big deal,
Right.
right? Just a little antiseptic and a bandage, and you're good to go. But
Yeah.
what if that simple scrape doesn't heal?
Mm.
What if it becomes a chronic wound, impacting, your daily life, your mobility, even your mental well-being?
Right.
Something that millions of people face globally.
Mm.
And it highlights just how important proper wound care is.
Absolutely.
And speaking of wound care expertise, a huge shout out to London Heartbeat Z Academy for partnering with us on this deep dive.
Yes.
They offer over 150 courses on tons of different healthcare topics, so seriously, check them out.
Yeah.
Their Facebook, Instagram, Spotify, and YouTube channels are full of free updates and insights you don't want to miss out.
For sure.
So today we're going to take you on this journey through a study that tackled a really practical problem:
Okay.
how to bring the best possible wound care to patients across multiple hospitals. Think about the logistics of that.
Oh, yeah.
That's huge.
It's a massive undertaking, and this particular study was conducted in Australia.
Oh,
And what's so fascinating is that it didn't start with, some groundbreaking new treatment.
right.
It started with a simple but critical observation. Wound care practices across this large health service were just all over the place.
Really?
Inconsistent, outdated, and as a result, incredibly costly.
It's easy to get caught up in the numbers, but we can't forget about the human impact.
Oh, for sure.
This isn't just about budgets. It's about real people dealing with pain,
Yeah.
limited mobility and the risk of complications
Absolutely.
from poorly managed wounds.
The study emphasizes that quality of life that should be paramount, and that's what drove their ambitious goal to standardize wound care across 10 different sites and services to ultimately lead to better outcomes and a better experience for patients.
10 sites.
Yeah.
That's a logistical maze. I'm curious, did the study shed any light on who was actually delivering this wound care across such a diverse network?
Yeah, that's where it gets really interesting. The study revealed a surprisingly wide range of individuals involved in wound care.
Ah,
Clinicians in hospitals, nurses in various settings, even patients and their families managing wounds at home.
wow.
So this diversity really underscored the need for a standardized approach. You want everyone, regardless of their role or location, to be equipped with the same evidence-based knowledge.
It makes you realize just how many touch points there are in a patient's wound care journey, but I imagine getting everyone on the same page,
Right.
especially when you have experienced clinicians who've been doing things their way for years, must have been a huge challenge.
You're absolutely right. The study acknowledges those challenges head-on: resistance to change, varying levels of comfort with new practices. The sheer scale of coordinating across 10 sites, these were all hurdles they had to overcome.
It's that classic tension between standardization and autonomy. How did they navigate that?
They took a very deliberate approach, opting for collaboration over dictation. They brought together clinicians, nurses, other stakeholders from all 10 sites to develop evidence-based guidelines and policies. It was about creating a sense of ownership, not just imposing a top-down solution.
So building consensus from the ground up.
Exactly.
That's smart. But did they try to create a one-size-fits-all approach, or did they recognize that different sites have unique needs?
They were very mindful of that. The study recognized that cookie-cutter solutions rarely work in healthcare, so they categorized their guidelines by the complexity of the wounds they addressed, allowing for tailoring to the specific needs of each site and service.
Okay, so they laid the groundwork with these evidence-based guidelines, but guidelines are just words on paper unless they're put into action.
Yeah.
How did they actually go about implementing these changes and getting buy-in from busy clinicians?
Well, one crucial step was appointing a dedicated wound care program manager. This individual served as a champion for the initiative, providing support, addressing concerns, and really driving the implementation process forward. Having that central point of contact was key.
Ah, so someone to keep the momentum going and ensure things didn't get bogged down in bureaucracy.
Exactly. And to further foster ownership, they established local wound care committees at each site.
Okay.
This ensured accountability and allowed for tailoring the implementation to the unique circumstances of each location.
That makes sense. It's like they created a network of mini champions all working together towards the same goal. But let's get down to the nitty-gritty. How did they actually change the way wound care was being delivered day to day? What did these new practices look like?
One of the key strategies they employed was the concept of bundles of care.
Bundles of care.
Yeah, these are small sets of proven interventions, typically 3 to 5, that when applied together have been shown to significantly improve outcomes. It's about focusing on a few key things that can make a real difference rather than trying to change everything at once.
So instead of overwhelming clinicians with a mountain of new protocols, they honed in on the interventions with the highest impact. Do you have an example of one of these bundles?
Yeah, a great example highlighted in the study is the implementation of a new leg ulcer guideline.
Now, this is where it gets really interesting for me. Leg ulcers are a huge problem,
Yeah.
and finding ways to improve their management can make a real difference in people's lives. Tell me more about that guideline and the impact it had.
So this guideline focused on a bundle of 8 specific interventions for treating leg ulcers, and the study meticulously tracked compliance with these interventions before and after the guideline was rolled out. Essentially, they wanted to see if focusing on these specific actions actually moved the needle.
And did it? What were the results?
The results were pretty remarkable. They saw a dramatic improvement in compliance with the individual interventions within the bundle, for instance. Compliance with one particular intervention jumped from a dismal 26% to an impressive 84%.
Wow, that's a significant increase.
Yeah.
So real tangible improvements, but I'm guessing it wasn't all smooth sailing, even with these targeted interventions. Did they face any challenges in getting consistent adherence?
You're right, it wasn't a perfect transition, even with the focus bundles achieving perfect adherence to all 8 interventions in the leg ulcer bundle remained a challenge. The study found that on average, only about 7.7% of patients received all 8 interventions.
So room for improvement, which makes sense. Changing ingrained habits takes time and effort. But even with those challenges, what was the overall takeaway in terms of patient outcomes? Did these changes actually translate into better healing and reduced costs?
The study emphasizes that while improved compliance with individual interventions is a positive sign, the real measure of success lies in improved healing times and decreased healthcare costs. These are the ultimate goals.
Absolutely. It's about seeing those interventions translate into tangible benefits for patients and the healthcare system as a whole.
Precisely. And while the study acknowledges that they were still in the early stages of implementation, they were already starting to see positive trends in those areas, wounds healing faster, and costs beginning to decline.
So a promising start, laying the foundation for long-term improvement in wound care practices.
Yes, and the study stresses that this is an ongoing process. It's not about reaching a finish line, but about continuous evaluation and refinement of wound care practices to ensure they're always evolving and adapting to the latest evidence and the needs of patients. And that actually brings up a really important question that goes beyond wound care itself.
Okay, I'm listening. What's the bigger picture here?
Well, you see, if we look at what the study actually accomplished, it kind of gives us a blueprint for improving any area of healthcare where consistency and standardization are really crucial.
Okay.
Think about things like medication safety, preventing infections, even managing chronic conditions.
I see what you mean. It's about recognizing that even small changes, when applied consistently across the board, can have a ripple effect on patient outcomes.
Exactly. And this study highlights how to empower clinicians with the knowledge and tools they need to deliver the best possible care, no matter how experienced they are or the specific setting they're working in.
I love how you framed it as a blueprint.
Hmm.
It really is like a step-by-step guide for anyone looking to implement meaningful change within a really complex healthcare system. And what really stands out to me is that emphasis on continuous improvement.
Yeah.
It's not about achieving perfection overnight.
Yeah.
It's about creating a system that's constantly evolving and adapting.
Right. And that brings us to another crucial element that's highlighted in the study, the importance of strong leadership.
Okay.
That dedicated wound care program manager that we talked about played a critical role in driving this initiative forward and keeping everyone focused on the shared goal. We need those champions of change in every area of healthcare.
And those champions need the right support system, right?
Oh,
They
absolutely.
need adequate resources. They need clear buy-in from leadership at every level
Yeah.
and the authority to make decisions and implement changes without being bogged down by red tape.
It truly is a team effort, from the clinicians on the front lines to the administrators overseeing the entire system. Everyone has a role to play in creating that culture of continuous improvement.
And a key part of that culture is relying on data to guide decision-making.
Oh, for sure.
It's not just about gut feelings or anecdotal evidence.
Mm.
It's about constantly tracking outcomes,
Mhm.
measuring progress, and using that information to inform our actions.
Data-driven decision-making is essential,
Yeah,
and this wound care study really showcases the power of data.
absolutely.
It's how they identified areas for improvement, they tracked their progress over time, and ultimately demonstrated the real-world impact of their efforts.
But it's not just about crunching numbers, right?
Right.
It's about connecting those numbers back to the human element. Are these changes actually leading to better lives?
Mm.
For patients, are wounds healing faster? Are people experiencing less pain and returning to their daily activities more quickly?
Those are the questions that should be driving every improvement initiative. At
Yeah.
the end of the day, it's all about improving the lives of the people we serve.
And this study gives us reason to be optimistic.
Yeah.
It demonstrates that even within a complex healthcare system spanning multiple sites, meaningful change is possible. It takes time, it takes dedicated effort, but it's absolutely achievable.
And the potential benefits are enormous better outcomes for patients who reduce healthcare costs and a more engaged and empowered healthcare workforce.
Right.
Those are goals worth striving for.
Couldn't agree more so to our listeners out there. If you're feeling inspired by what you've heard today, I encourage you to think about how these principles might apply to your own work, whether you're a clinician, an administrator, or a patient advocate. We all have a role to play in creating a healthcare system that truly delivers the best possible care.
And don't forget to explore those incredible resources from London Heartbeats Academy. They're doing fantastic work in educating and inspiring healthcare professionals.
Absolutely. They're a wealth of knowledge.
Yeah.
Okay, before we wrap up this deep dive into best practice wound care, I want to touch on one more crucial aspect highlighted in this study.
What's that?
Sustainability, it's one thing to implement a change, but it's a whole other challenge to make that change stick.
Yeah.
How did this study address the challenge of ensuring that these improved wound care practices would become the new normal, not just a temporary initiative?
That's a fantastic question, and one the study addresses directly. They acknowledged that sustainability needed to be a core focus from the very beginning.
Yeah.
They knew that without a plan to weave these changes into the very fabric of the healthcare system, they were likely to fade away once the initial enthusiasm and resources dwindled.
So they baked sustainability into the process from the outset. What were some of the key strategies they used to achieve that?
One key strategy was ensuring ownership at the local level. Remember those local wound care committees we discussed earlier?
Yeah.
They weren't just there to implement the guidelines passively. They were also responsible for monitoring progress at their site, identifying any challenges that arose, and working collaboratively to find solutions.
So it wasn't a top-down approach where decisions were made in a vacuum.
Mm-hmm.
The people on the ground, those dealing with the realities of wound care every day, were empowered to own the process and make it work within their specific context.
Exactly. That sense of ownership was essential for long-term success. And another important strategy was ongoing education and training.
Yeah.
They recognized that maintaining these improved practices required a commitment to continuous learning, keeping staff updated on the latest evidence and best practices in wound care.
That makes perfect sense. Healthcare is a constantly evolving field. We can't just rest on our laurels. We have to keep learning and adapting to stay ahead of the curve.
Absolutely. And they didn't just stop at education. They also built in robust systems for monitoring and feedback. They regularly collected data on compliance with the new guidelines, analyzed that data to pinpoint any areas where things weren't working as well as expected, and then provided that feedback to the local committees, creating a continuous loop of improvement.
So it's a dynamic process, always refining and adapting based on real-world data. Identify an area that needs improvement, provide targeted feedback, adjust the approach, and keep repeating that cycle.
That's the beauty of a data-driven approach. It provides a clear picture of what's working, what's not, and allows for course correction along the way.
And that data-driven approach fosters a sense of accountability. When you know that your performance is being tracked and that you'll be receiving feedback, you're more likely to stay engaged and committed to the process.
Right. It's not about pointing fingers or assigning blame. It's about using data as a tool for learning, for growth, and for creating a culture of continuous improvement.
And that's what sustainability is all about. It's about creating a system where best practices become so ingrained in the way things are done that they're no longer seen as an initiative, but simply as the way we deliver care day in and day out.
It's about making those improvements the new normal.
Yeah.
And this wound care study provides a roadmap for how to achieve that in any area of healthcare.
Roadmap we could all learn from regardless of our specific role or area of expertise.
And it's important to remember that the journey doesn't end with implementation. It's an ongoing process requiring us to stay curious, stay engaged, and keep striving for better outcomes for our patients.
Beautifully said. Well, folks, it looks like we've reached the end of our deep dive into best practice wound care. But before we sign off, I want to leave you with one final thought to ponder. This study focused on the power of standardizing care. And we talked about, the great benefits of that, creating consistency, ensuring everyone's on the same page, working from that same evidence-based playbook.
Right.
But it raises a question that's been on my mind.
Yeah.
How do we balance that standardization with the need to personalize care? Because every patient walks in with their own unique medical history, lifestyle preferences.
You've hit on a crucial point. It's something we can never overlook when we talk about standardizing care. Healthcare can't be a one-size-fits-all approach,
Yeah.
because each patient is an individual.
Right. So how do we make sure that individual patient is considered even within a framework of standardized guidelines?
Well, it starts with good old-fashioned communication. Clinicians need to take the time to truly listen to their patients, understand their individual concerns, and really involve them in the decision-making process. It's a partnership, not a dictatorship.
It's about shared decision-making, isn't it?
Absolutely.
Not just presenting the patient with the right answer, but explaining the evidence, outlining the options, and working together to choose the path that best fits that specific person's needs and circumstances.
Precisely. And that often means being flexible. The guideline should be seen as a foundation, a starting point, not a rigid set of rules etched in stone. There will inevitably be cases where deviating from the standard protocol is in the best interest of the patient.
So it comes down to using clinical judgment, drawing on experience, and really relying on that deep understanding of the individual patient to make informed decisions.
Exactly. And that's where robust documentation becomes crucial. Anytime there's a deviation from the standard guidelines, it's essential to document the reasons behind that decision. This allows for tracking analysis and continuous learning. If we're consistently seeing deviations from a particular guideline, it could signal a need to revisit that guideline or to provide additional training and support to clinicians.
It also goes back to that concept of continuous improvement we discussed earlier, always learning, always adapting, and always putting the patient at the center of care.
That's the essence of providing truly excellent care, and it's what makes healthcare such a challenging but ultimately rewarding field.
Well said. So to our listeners, I hope this deep dive has given you a new perspective on wound care. It's more than just bandages and ointments. It's a complex field that requires a delicate balance of, standardized practices, individual patient needs, and a commitment to ongoing learning and improvement.
We hope it sparked your curiosity and inspired you to keep exploring this important area of healthcare. Remember, even seemingly small improvements in wound care can have a profound impact on people's lives.
Absolutely. And those improvements start with each and every one of us. Stay curious, stay engaged, and keep striving to provide the best possible care for your patients.
Thank you for joining us on this deep dive.
And be sure to tune in next time for another fascinating exploration of the world of healthcare.